So yeah, we will be recording this. We hope to put it on our YouTube page and share it out with our members. So again, welcome everybody. So my name is Yesenia Buenorso Ramirez. I am the CaHPSA coordinator. I've been a part of CAHPA and CaHPSA for over a year now, a year and a half maybe. And I started off as a volunteer with, one of the first online Medicare events they held a couple years ago. And I had the honor of working with Firuz. At the time, she was the CaHPSA coordinator. And since then, I became an intern. And then I was offered a part-time position, which I was just ecstatic about. I'm very excited to transition to full-time this fall. So really excited to continue working with everybody and our growing team. So a little bit about CaHPSA in case you all are not familiar. It stands for California Health Professional Student Alliance. And what we're just a statewide network of pre-health students, pre-med students, graduate medical students, and we're all just on the same mission and have the same goal to really advocate for health justice and an equitable universal healthcare system. And so we started back in 2005 with Dr. Parker Duncan. From there, he had this idea. At the time, he was, I think, a first-year med student, and he wanted to just really get more students involved with our parent organization, which is California Physicians Alliance, which you will hear a little bit about in a couple moments. And so then in 2009, we started involving, different campus leaders. We planned, I say we, but the students at the time planned a really great lobby day, which has been one of the biggest events that CaHPSA hosts and leads. And then in 2010, we started training leaders to really continue expanding CaHPSA. So we developed a lot of chapters throughout California. And this coming year, we will actually be starting a CaHPSA student board. So it's definitely moving in the right direction, I would say. And I'm excited to be a part of CaHPSA's growth. So I don't know if Beatriz has joined in. Yes, she has.
I'm here.
Hi, Beatriz. Thank you for joining us. I will go ahead and hand it over to you.
Yes. Hi. Good evening, everyone. I'm so excited to be here. It's my first time actually joining the closing ceremony, and I heard wonderful things about this actual closing ceremony in 2021. But of course, I knew about the summer internships that Yesenia created. She started this summer program last year. And so, as she said, this is the second year and I've seen it grow. I love that students are involved. Students have been involved from the very first day they started the internship and throughout last year. At least that was for the cohort last year. And I'm very excited for you because this is just the beginning of your health advocacy journey. That is assuming that you're new to it, but you probably are not, right? You came to apply to this internship because you had an interest, because perhaps you had done it before. And we hope, and if you had, we hope that in this internship, you were able to learn a lot about what's being done in California health policy and how to advocate, an improved way to advocate. And I hope that you learned and enhanced a lot of new skills. So I am very excited for you. Again, I am the Executive Director of California Physicians Alliance. My name is Beatriz Sosa Prado, and I actually learned about single payer back in 2008. I wasn't sure what single payer really was. I just knew that it had something to do with healthcare justice, and I was all in. I got involved. I was also a student in CaHPSA. I was part of the very first group of students. Back then, we only had 2 chapters, and I was part of the Southern California CaHPSA chapter. And so my journey began, right, since the day that I learned about single payer. And I learned it from Dr. Parker Duncan when he was a first-year medical student. He is now on our CaHPSA board, our CAHPA board, and is very instrumental in helping us organize and direct the student organization that you are now part of. So thank you so much for inviting me here today to speak to you and express how excited I am for you. And definitely, I know that Yessi has mentioned this throughout the internship, but we want to offer you our support as you are embarking on this health advocacy journey and in your careers in healthcare, whether it's medicine, public health, or any other field that you choose to go into, because that is where you belong. You belong in spaces where you can bring yourself out, be your true self, and elevate your voice to create change in the world. And this is one way that you're making it happen. I'm really excited to see your presentations today. And I just would like to highlight some of the work that the California Physicians Alliance has been doing in the last few years. So let me just start off. I picked out just a few. Let me tell you about the involvement that CaHPSA, how we got involved with the Governor Gavin Newsom's Healthy California for All Commission. And that happened for 2 years, at the end of 2019, and they just resumed, they ended their activities in May 2022, when they wrote a final report that they gave to the governor. And in this report, it's a compilation of ideas and a pathway to get California to a unified financing, basically like what single payer could look like in California. In other words, a universal healthcare system for California. And so CaHPSA was involved by providing public comments. And when I came and presented to you, I talked about how I provide public comment, right? Like, how do I prepare to provide that public comment? And so I hope that you were able to learn some tips from that. And the second thing is we are involved in 2 statewide coalitions. The first one is a Health for All coalition that advocates for getting all Californians included in the Medi-Cal system. And some of the recent wins that we've celebrated in the coalition in California is that Medi-Cal was expanded to cover Californians, income eligible Californians who are 50 years and older, regardless of immigration status, in Medi-Cal. And that is a win. CaHPSA for many years saw that it was very important for us to include our undocumented California neighbors and family members into our public healthcare system, right? Or in the healthcare system that we want, which is a single payer system, a universal healthcare system. And so advocating for this inclusion in Medi-Cal was definitely a win for us and for the entire coalition. And I believe you had Ivan Barragan, who is at the California Immigrant Policy Center. And I believe he is on this call. And we are also celebrating the fact that Governor Newsom proposed his budget for 2022 and 2023, where he also talked about expanding Medi-Cal access to undocumented Californians ages 26 to 49. And so that again is another win, because that just, it makes California, we are the first and only state in the entire nation that is including undocumented Californians in our public healthcare system. And again, I want to highlight that California is a leader in healthcare and in many other issues, social issues. And we are a leader. We are definitely a model for the rest of the nation. So I'll just stop there. I know that Yessi has included a lot of the other things that the parent organization, CaHPSA, has been doing, along with what the student organization is doing. So in the fall, Yessi mentioned she will be transitioning into a full-time employee for CaHPSA, and she will continue being the CaHPSA coordinator. We have a lot of ideas about how we are going to expand the student section. And I am just very excited already. Every time I speak to Yessi, we're bubbling up with ideas and writing them down. And I love that Yessi has the energy and the passion and the commitment to continue this journey. So I will end there, and thank you once again. I look forward to hearing all of your presentations.
Thank you so much, Beatriz. I really appreciate the kind words, and just thank you for sharing, CaHPSA updates. And for those that may not be too familiar with our parent organization, but we'll go ahead and move along to just welcoming all of our interns, our amazing interns. This is, I think, one of my favorite pictures that I've taken. They have such great smiles, and they're showing off their CaHPSA shirts, and they had some notebooks. And so we were really excited that this year we were able to provide them with, just something sentimental. I feel like this is something that they'll look at and refer to, and just, be reminded of the community that they've built over the past 4 weeks here. So I'll go ahead and stop sharing here. I'll hand it over to our first intern, Jimena Sanchez. So she will go ahead and share her screen and go ahead and present.
Hello, everyone. My name is Jimena Sanchez Martinez. Thank you so much for joining. I'm very excited to share my presentation with y'all. And the title of my presentation is Financial Security Starts with Financial Literacy. And the bill that I focus on is Assembly Bill 2215, which is titled Public Instruction, Financial Education. And just a little background about myself. My name, as I mentioned, Jimena Sanchez Martinez. I use she, her pronouns, and put a typo there. But I'm a senior at Stanford University, and I'm a co-term student, which means I'm enrolled in a dual enrollment program. And I'm pursuing my bachelor's in comparative studies in race and ethnicity and my master's in biology. And my educational goals are to become a pediatrician and pursue a PhD in medical anthropology. My goal, I'm a very community-oriented individual, and at the end of the day, I hope to be able to provide free medical care or just support a lot of migrant families, and especially their children, because I definitely, one of the things I'm passionate about is addressing the language barrier. And so I work as a Spanish interpreter at one of the free clinics here at Stanford. And so that's definitely one of my passions, just being able to use my ability to communicate with the patients in Spanish to provide them with support and comfort. And then I also want to do medical anthropology. I recently learned about this field, and I'm very interested in using that and just study the intersection of race in medicine and be able to do research studies and just provide a platform to minorities to be able to share their stories in medicine. Okay, and so I'll start with some of the internship takeaways. With the first one, it takes a village. One of the greatest things I learned is that the coalition here is really important and everyone plays a role. And so that's something that I've never seen before. This is my first time actually learning, diving into the health policy field. Because as a biology student, I focused just on the cells and whatnot. And so this opportunity meant a lot because I really wanted to get more involved in health policy or just have more idea on the way that it works. And the other thing that I'm taking away is, so for this upcoming academic year, I'm going to be one of the presidents for Comunidad for Health Equity, which at Stanford is the premier organization. And it also doesn't get involved a lot in health policy. We do have plenty of students that want to be more involved, but we don't know how to involve them because it's easier to find bench opportunities at labs and at the medical school. And so one of the things that I'm looking forward to is reaching back to the people that have spoken to us and giving us workshops to invite them over to talk with our students that want to get more involved in health policy. And so those being Young Invincibles with health insurance literacy, definitely learned a lot of terms that I had never heard before, and it's very valuable information. And then with the California Immigration Policy Center, definitely believe a lot of our students are interested in going in that direction. And so I definitely want to invite Ivan again, just to talk to our students here on campus. And then with Pre-Heard Dreamers, because we have some undocumented students on campus that aren't sure how to pursue a career in medicine or health policy. And so I definitely want to invite them back again. And then the last takeaway that I'm taking is the advice and resources for a path in medicine. As a first generation student, this is all new to me. And I've met a lot of students here that are also first generation and have provided a lot of invaluable advice. And I just listed one, which is Mi Mentor. And so I'm very excited to be able to take away those resources, but also continue to share them with students on campus. And just to introduce the bill that I'm going to be talking about and its importance. So it was introduced by Assembly Member Blanca Rubio, and it's co-authored by Assembly Member Villa Pudua. And so the latest action that I saw on the website for this bill is that it was referred to the Committee on Education on June 1st, 2022. And basically, this bill is an act to add section 5128.4.7 to Education Code, which means that it would require the State Department of Education to develop curriculum, instructional materials, and professional development resources related to personal finance. And it also talked a little more about some of the responsibilities that the department would have, which is to it would require it to communicate to school districts, county officials of education, charter schools, just on the financial literacy content in history, social science framework, and also provide strategies for expanding provision and increasing quality of financial education instruction. The key thing being the quality, because as we all know, there are schools that don't get the same amount of resources compared to other schools, and the quality of education might not be the same, but providing a base standard would be very critical to be able to support schools in providing personal finance instruction. And then the last few responsibilities that this bill mentioned is that the department would be responsible for reviewing financial education curriculum available to local education agencies, and also update the ongoing basis of financial literacy resources that are listed on its internet. And so this is just a breakdown of the bill that caught my interest. And so now changing gears into why this bill is important. And so as of right now, there is no financial literacy graduation requirement in California. Schools and districts are encouraged to incorporate it, whether that's in required economic courses or just where they see fit. But right now, the key thing being that it's not a graduation requirement. So schools are not forced to help students learn financial literacy. And then again, there's no standard curriculum for financial education, but this bill would help get started with the standard that schools can use. And the other reason is that I found this report from the Chaplain College Center for Financial Literacy, in which they grade each state on the financial literacy that they provide to students. And California is one of the few states, as you can see on the map, that got an F. And so as you can see, the California strength is not in providing financial literacy to students. And the other thing that they found is that the low-income students, low-income schools nationwide are half as likely as their affluent peers to have taken personal finance classes. And then when they remove the only 5 states that got an A, this percentage drops to only 5%. And as you can see, we're doing a disservice to our students that are in low-income schools or just low-income students, because a lot of them come to college not knowing the terminology that would be important for them to succeed. I definitely experienced that going to campus. And so on campus here at Stanford, that's when I finally started getting involved in just financial literacy and learning more about the terms that have an impact on my life. And the biggest one that I learned was this term on financial security, which means having enough money to cover your expenses, emergencies, or retirement without the fear of running out. And then also they mentioned some of the impacts that financial stress has on students, which is decreased mental well-being and decreased social functioning. And then they gave me an example of what security and freedom means right now in the present versus the future, which is being able to meet basic needs day to day. And then in the future, is meeting basic needs that one can predict. And the way that we're able to do that is by having savings and being able to budget. But if students are not aware of the strategies that they need, then they're not going to be very successful. Because I remember the first time I got a scholarship, I didn't hear anything on like how to save my money. And unfortunately, I didn't make the best financial decisions. And so it ended up being a huge stressor to me. And that's one of the reasons why I believe this bill is very important. And then financial freedom is being able to do and have what you want when you want to do and have it. And then in the future is just being able to predict and plan for what you want to have and do. But as I mentioned, these two things won't be possible if students don't have the basic skills of financial literacy, which is also just understanding the different loans that are available, because we know a lot of students have to take loans to finish their to finish their higher education journey. And so without understanding what those loans means, then students won't be able to make the best decisions. And then there's also the whole talk on credit scores that we don't learn of in high school. And so that's very important why this bill should be passed. The one thing that I do want to mention is that this bill doesn't say that it's a requirement for graduation. So although it's a start for students to get that financial literacy education that they need, by this being able to provide some type of standard, the next step with this financial literacy is to make it a graduation requirement. And so that's one key thing that I do want to point out in this presentation. And so a big takeaway for this is I just want you, all of us to remember that financial security starts with financial literacy, and that can't happen if we don't provide the education that students need. Thank you.
Thank you so much, Jimena. That was really great. I will go ahead and if anybody has one pressing question, we have time for one question for Jimena. If not, we can go ahead and, oh, go ahead, Beatriz.
Yeah, so just my question, I guess it would be for everyone, and I know everybody will have a turn, but it would be nice, you know, at the end to say it. I know Jimena mentioned this, but to remind us all, like what sparked your interest in this particular bill? Just, you know, something short and sweet would be nice, just to remind us all.
Yes, of course, B. Our interns will definitely have that to add at the end, if not already included in their presentation. So Kylie, do you want to go ahead and share your screen?
Sure, yeah. Okay, there we go. So hi everyone. First of all, thank you for being here and taking the time out of your day. And if you're watching on the recording, thank you for watching. Maybe you're watching in 2 times, I don't know. More power to you if you are. This is my presentation, Keeping Life Sweet. I'm going to be talking a little bit about the California Senate Bill 473, but also just a little bit about my time in this CaHPSA internship the last 4 weeks. Just as a brief introduction, because I'm sure most of you don't know who I am. My name is Kylie Jo. I'm from Huntington Beach, and I've spent most of my life in Southern California, in LA and Orange County. I am currently going into my 3rd year at UCLA. I'm studying physiological science and minoring in public health. But aside from that, I really love traveling, basically anything in nature. I'm a beekeeper and I love observing and interacting with animals. I grew up golfing and I currently work at a golf course, so that probably has to do with why I like to be outside so much. But overall, I just really love new experiences and learning and being exposed to different perspectives and ideas, which was a lot of the reason I joined this internship. And I definitely got that out of it. In the future, I really want to work somewhat in health policy. There's a lot of issues that I want to affect. And I feel like I'm always learning more that I don't know about yet, that I will be adding to that list. But my biggest passion right now is environmental health and environmental health equity. And I also hope to change a little bit of the environmental impact of the healthcare industry itself, because like I said, I love being in nature and I've had the privilege of enjoying really clean beaches and hiking spaces, but a lot of people don't get the chance to experience that. And even worse, they live in areas where the environment is so far unchecked that it's actually making their health worse and putting them at a disadvantage, and a need for greater care that they shouldn't have to really necessarily worry about. So I want to change that. And also professionally, I hope to work in pediatrics or as an anesthesiologist, which can change as I learn about different specialties, but I do know I want to work somewhat in that area with kids and be very hands-on in my day-to-day. So to start off the presentation, I wanted to talk a little bit about my experience as an intern, since that's the whole reason I'm speaking to you today. And I also need to thank ESC and also B for letting me have that opportunity. Some of the experiences that really stood out to me and the lessons that I'll be definitely taking with me in the future are kind of listed here, but I didn't really know that much about the legislative process broadly from like history classes at school that I was half paying attention to, but I didn't really know anything about my role as a non-professional, as just a citizen. And I really appreciated learning the different ways to advocate and educate myself through that whole process during this internship. I also learned a lot more about the depth and importance of having community partnerships and collaboration. I know Jimena talked about it a little bit. The coalitions that spoke to us really showed a lot to me about how closely CaHPSA and other organizations work together and how important that is for their work, which I really appreciated to learn about that kind of teamwork that's so necessary and help so much, even if the organizations don't have the same direct mission. And I also really appreciated the opportunity to have support, to be given a safe space to practice advocating. I don't necessarily think I'm very educated in advocating, and being able to learn to give public comments and understand bills and motions alongside others here and not be judged for it and just kind of be together learning was really a great experience for me. Which brings me to my last point, which is that the most important and long-lasting thing that I'm going to be taking away from this internship was the wonderful people that we got to meet, the speakers and really the other interns in Yesenia. I learned so much from everyone, from everyone's perspectives and ideas, and I really appreciate that. And I'm definitely going to be using them in my future. So now we're going to talk about the bill, which is why we're all here today. It's California Senate Bill 473, like I said, and it is focused on insulin cost sharing. Just a little bit of background for why it is so important to me. Because preparing for this presentation, I did have a lot of hope for our future in California healthcare. There's a lot of bills that would improve our coverage and access and equity in healthcare in California. And I wanted to talk about all of them, but I chose this one because it was personally pretty important. My grandmother, who was an immigrant from Hong Kong, passed away about 3 months ago, largely because of complications with diabetes that she'd been fighting for decades. But I got to spend 20 years getting to know her and getting to love her and feel her love because she was lucky enough to have access to health insurance and affordable insulin to keep her going. But without bills like this that are protecting people's ability to afford insulin and treatment for diabetes, a lot of others won't be able to say the same as me. A lot of others haven't been able to say the same as me. And they'll instead lose out on a lot of valuable time with their loved ones, not only because of the physical strain that a lack of easy access to insulin imparts, but because of the mental stress that comes with having to worry about healthcare costs and access. In my opinion, health treatment and complications should never have like financial barriers, but that's largely the case with diabetes and a lot of other treatments, considering insulin is so effective and reproducible, and the largest barrier to it is somehow affordability. That's just really saddening to me. But this bill and its impact really encompasses, in my mind, part of the CaHPSA mission, just to provide universal access to healthcare. And it's really small but impactful step, I think, in doing so and working towards that, which is why I thought it was important to talk about today. To get more specific about the bill itself and what it would do from a legislative standpoint, as well as its community impact if it is implemented. It was introduced and authored by Patricia C. Bates, who is a Republican senator from District 36, and co-authored by Susan Rubio, a Democratic from District 22, and that was back in February 2021. So it's gone through 3 amendments in the Senate, and most recently one in the Assembly. There's going to be another hearing in August as well. If anybody's interested in that, I can send you the information. But its main legislative duty will be to cap insurance and health plans in the amount of money they're allowed to require as a copay for diabetes patients who need insulin to $35 per month. And there's a few extra inclusions to make sure that it isn't undermined somehow with deductibles or other forms of cost sharing that could affect the patient, which I think are really important. And all of these actions build off of the Knox-Keene Health Service Plan Act from 1975 that allow regulation of health insurance plans and other plans in this exact manner, as done by the government. As far as the overall impact of this bill and the community, and the reason really that it's so important to me, financial protections are going to allow for equity, at least to a further extent than current, and really improve lifestyles in a myriad of ways. The bill provides for future accessibility to diabetes management and many different treatment supplies, and this increased accessibility and affordability will hopefully lead to decreased practice of low insulin use, which is really common. Many diabetic patients have reported to resulting to using less insulin than is good for their current state because of the high cost. And in the long run, this bill will prevent that and also be super important because it'll decrease the frequency of diabetes related complications such as heart disease and nerve damage and kidney disease that come from low insulin use or a lack of insulin use altogether because of the cost. To wrap up a little bit, I wanted to talk about some of what the future looks like related to the issue this bill focused on. Because I know that it's not guaranteed that the bill passes. So I wanted to mention some related actions that are happening in the area of increasing access and affordability of insulin. For one, Gavin Newsom announced a plan to allot $100 million to insulin production and development in California to not only develop more cost-effective insulin products, but also a California-based manufacturing plant to help streamline and reduce costs for California residents specifically. And that was announced, like, I think last week. So it's really recent, but it's in the budget, which is really, really good, I think. And there's also a bill passed in the House called the Affordable Insulin Now Act. It's really similar to the Senate bill we just talked about today, except it focuses on reducing cost sharing to $35 specifically for those under Medicare Part D and a couple other specific plans. And for the future, there's a bipartisan bill being formed by Senator Jeanne Shaheen and Suzanne Collins. And it'll go further into the issue to not only reduce costs for patients, but to address rising prices for insulin, which I think is really important. That's all I really have for you today, but if anyone knows of any resources related to this issue or similar issues, or really just any way to support this kind of access, please let me know. I would love to talk to you and learn more. I am still very new to this subject, so I would love to hear anything you have to say. And I'm including my contact info here if anybody would want to reach out, or you could also just DM me in here. But thank you for listening and taking the time to be here with me today.
Thank you so much, Kylie. That was really great. Do we have time for like one question if anybody has a specific question for Kylie? But I think in the chat, I don't know if you saw, Kylie, we all share the same sentiment. Thank you for sharing the story about your grandmother. And, we send our condolences and a big hug. I know that must have been very difficult. Okay, so I don't think there's a pressing question. So we'll go ahead and hand it over to our next intern, Nisha Joseph. Thank you, Nisha.
No problem. Hello, everyone. Hope you all are doing well this evening. My name is Nisha, as Yesenia mentioned. So the title of my presentation is Let's Jumpstart Eager Youth Facing Homelessness Future with Senate Bill 1341. And I'm excited to get started. So my presentation, there's going to be a couple of things. I'm going to talk about who I am, what I learned regarding the Senate Bill 1341, and my passions, and also the bill itself. So my name is Nisha Joseph. I'm currently a rising fourth year at UCLA, majoring in psychology. I'm from South Los Angeles, and I'm excited to share with you all. So many of you may ask why Senate Bill 1341? And it's because, it's focusing on homeless or pupils or students that are facing homelessness and providing them with temporary guaranteed income. And the bill is to also focus on how to provide them with some sustainability when it comes to financial, so guaranteed income of $1,000 a month for 5 months. But also when it comes to homelessness, there's so many reasons why many of these youth are facing homelessness. And this is why it was very near and dear to me, because, homelessness is impacting a lot of our community members, but also many youth are included in this homeless population. And when it comes to homelessness, it can be because of ACEs and it's adverse childhood experiences. And, it's growing up in Los Angeles, it's already expensive, but also, not having that support or, going through a different mental illness or any other complications that are associated with homelessness. And here I have on the left, I have have like ACEs, and there are some certain things that are really prevalent when it comes to ACEs, and it's abuse, neglect, and household dysfunction. And when it comes to abuse, physical and emotional are two of the main types of abuse. And when it comes to neglect, it's physical and emotional. Many of these youth who are facing homelessness are, are affected by some form of abuse, neglect, or household dysfunction. And many of you may ask why, like how household dysfunction can play a role in, these youth that are facing homelessness. And it's mental illness because some of them, they don't have the resources, or they're not aware of the resources that are for mental illness. Therefore, they go prolonged with mental illness, and they're not able to get the resources that they need. Therefore, now they're facing homelessness and also trying to get an education. Also, they have an incarcerated relative because we know that our prison pipeline education is a concern that we also have in Los Angeles County, or in California. But, many of these families are affected by incarceration. And the mother was treated violently. So it comes down to domestic violence. And these children are seeing that. And this can affect their development as well. And substance abuse is something that we also can make note of. And the goal of the Senate Bill 1341 is to give them a chance. And they're going to be graduating seniors, but it's supposed to be a bill that's supposed to be implementing as of next year, January 2023. And we know that youth homelessness is a growing problem because we know that homelessness is already a concern that we have in Los Angeles or in California. So the goal is to end youth homelessness. And my reflections after the 4 weeks with the CaHPSA internship will be learning more about public comment, because prior to doing the internship, didn't really know much about that. However, I've heard of it, but now I know the formal terminology, and it's when you're able to go into different meetings, legislative meeting, and you're able to make public comment on the topic that's being at hand, or to give some advocacy awareness about a bill or a topic or something at hand. And then universal health care, after these 4 weeks, we're able to learn more about healthcare for all, and how, working on the initiative or the goal of universal healthcare will be very ideal and great for many Americans, but also just for Californians, because we know that healthcare is a necessity. So after learning about that, I was able to learn more and how to follow these initiatives and how to be more involved in this initiative overall. And then advocacy and leadership. Over these 4 weeks, we have embarked on how to become advocates, but also how we can become leaders and how we can advocate for not only for our education, but for those that are coming behind us, and also advocating for our peers and how they can also get the education that they desire as well. So when it comes to Senate Bill 1341 and taking action, the first thing that can happen is bringing awareness via social media and handouts and contacting local legislators, because when it comes to the pupils or these students getting a fair opportunity, having 5 months of some financial of $1,000 for 5 months can be very critical and crucial, because it will, they already faced a lot of hardships and disparities, social determinants, and that's something that we also learned during these 4 weeks. But also when it comes to bringing awareness about this bill, many of these individuals can get a fair chance, coming out of high school and then going into college. They have some type of security, already had a hard time through grade school, and now they're going to higher education. If they have this a financial guarantee income for the homeless high school seniors, it will allow them to have a monthly check, and they'll be able to sustain and be able to afford some things, necessities that they might have not been able to get. So when it comes to Senate Bill 1341. It's a California Success Opportunity and Academic Resilience, which is SOAR Guaranteed Income Program, and it was authored by Senator Dave Cortez, who's a Democrat. And about he wants to focus on 15,000 high school students who are in the grade of 12th grade and they have to complete the FAFSA, or they can complete the California Dream Act application. And once they complete this, they're able to get some funding, but this won't go into effect until 2023 because it's going to be a bill that is focusing on class of 2023 seniors, but it'll give them a jump start because as from the month of April 1st to August 1st of 2023, they'll get $1,000 a month as long as they complete the FAFSA or the California Dream application. And this bill is for the taxable year beginning of January 1st, 2023, but it will exclude all of gross income for purposes for the personal income tax and the amount received as an award pursuant to the California SOAR Guaranteed Income Program. And then it won't factor any other income as long as they were homeless or they experienced homelessness during grade school. They do qualify for this grant or the SOAR Guaranteed Income Program, and the program will award public school pupils who are in the grades 12. And then under the bill, the award will not be considered financial aid, or it will not affect their other financial scholarships or anything that they get when they matriculate to a 4-year institute or to a community college. It doesn't affect that. It will just give them some extra income. And some things that I just want to add before moving on is that with this bill, many they'll get 5 months and it'll give them a financial boost, and it'll offset some of the costs, especially when it comes to going to matriculating to college. It's very expensive, and when you become independent or when you're experiencing homelessness, many of these students they're not able to get jobs because they don't have the resources. But also, having these resources, they can sustain themselves for the next 5 months while they're trying to juggle college and trying to navigate this new environment that they're experiencing. But also, they are able to also benefit from other public sources such as CalWorks, CalFresh, Medi-Cal, and other state programs that will allow them to get the resources that they need while they try to matriculate onto college. And I just want to say thank you and give a shout out to CaHPSA itself and Yesenia and my fellow interns and my family. Thank you for listening.
Thank you so much, Nisha. Really appreciate it. And I don't believe we have time for a question at the moment, but if y'all do have questions at the end, I'm sure we will have like about 5 minutes to address any questions to a specific intern. So in the meantime, I will transition over to Isabella.
Hi, everyone. My name is Isabella. Apologies for my voice. I am a little sick. My pronouns are she, hers. And my talk today is titled Transitioning into a More Inclusive Healthcare, Senate Bill 923, Gender Affirming Care. And to lay out my talk, I'm going to be talking a little about me, setting the stage for my bill, and then we'll dive a little into the bill and then talk about implications as a close. So a little about me. I was born in San Diego, California. I graduated from UC Berkeley in integrated biology and psychology, and I also did a minor in science and math education. Future career goals, I'm still undecided. I do enjoy research, so I might be pursuing academia, or I really have been thinking about the physician scientist route as well. Something really interesting I learned from the internship was the talk given by Angeles for pre-health dreamers. I learned a lot about the undocumented students' journey in pursuing pre-health, and it really just shed a lot of light on that, and talking about educational equity also was something that I feel really passionate about. And so that was something that really stuck with me from the internship. A highlight that I have from the internship is community building. I'm a really big community oriented person. And so getting to meet all the other interns, find out what everyone's passionate about was a big highlight for me. And I learned a lot from Yesenia B and all the other speakers that came to talk with us too. And it was just really inspiring to hear what we can do with health advocacy. And then transitioning a little, switching gears, we're gonna talk a little about the bill, but in order to do that, I'm gonna define 3 different terms for you all that will be integral in understanding the bill. And so first word is transgender. Someone who identifies as transgender is someone whose gender identity does not match their birth sex. Someone who's intersex, this definition is from Interact. It's differences in sex traits or reproductive anatomy. For example, someone could be born with both ovarian and testicular tissues. And then lastly, gender diverse or gender non-conforming are those that have gender identities that go beyond the binary. And fun fact today is actually International Non-Binary Day. So to set the stage for why this bill is needed, I wanted to go over some statistics regarding this community. And just going back really quick, these 3 terms will be condensed as TGI moving forward. That's how the bill also refers to this community. And so just a trigger warning though, I will be talking about suicide. So if you all do need to take some space, please do so. So the Trevor Project conducts a survey, and this year they released their national survey on LGBTQ youth mental health. And almost half of LGBTQ youth seriously considered attempting suicide in the past year. And then almost 20% of transgender and non-binary youth did attempt suicide. And then LGBTQ youth of color reported higher rates than their white peers. Also, less than 33% of transgender and non-binary youth found their home to be gender affirming. And then moving more into the healthcare field, I hope that healthcare can be a place where we can be gender affirming. And then in the US today, there has been a lot of anti-transgender legislation passing in different states such as Arizona. And as you can see here, the survey also showed that a large percentage of transgender and non-binary youth are worried about this. And so narrowing the scope down just a little, I wanted to talk a little about transgender discrimination in the healthcare setting specifically. And so here you can see a graphic that came out of the survey. About 1 in 5 transgender or gender nonconforming folks responded that they're refused care because of their being transgender or gender nonconforming. And then the 2 graphs are split between race and gender identity. And below the bottom graph, you can see MTF, which stands for male to female. And then next to that, FTM stands for female to male. And then GNC refers to gender nonconforming. And so you can see here that there is a disproportionate amount of different races and gender identities being refused care in healthcare. Lastly, because of this discrimination, transgender folks can also be discouraged to seek care. And so here you can see a large percentage of female to male transgender people postponing healthcare because of discrimination. And so you can see 2 different bars, preventative and needed healthcare as well. And so there's a need for kind of making sure our healthcare is being more inclusive to our TGI community. And so in comes the Senate Bill 923, Gender Affirming Care. So the first step of this bill requires training. And so it requires that healthcare services plans and health insurers require their staff, anyone that has direct contact with beneficiaries, to complete evidence-based cultural competency regarding the TGI community. You might be asking, well, what does this look like? What are they going to be learning about? Some examples of this training could include learning about the personal effects of the oppression and exclusion of the TGI communities, how to communicate effectively using TGI inclusive terminology, and that comes with using correct names, correct pronouns, and also avoiding language that assumes all are heterosexual and cisgender, etc. Also, part of this training will also include a tidbit if there is a complaint filed. The clinic or the physician or healthcare provider will also have to complete a refresher course, and the number of complaints will be documented in an annual report as well, so we can keep track of how this training is going as well. Second, to maintain your licensure as a healthcare provider, you will need to complete the CE requirement, which is continuing education credits. And so this bill includes learning about the TGI community in the CE requirement. Also, this bill including a directory update. And so the plans or insurance provider directory will have providers that can confirm that they offer or have provided gender affirming services or not, and this will make information more accessible to this community. Lastly, the bill also introduces a working group of at least 3 different groups. So these 3 different groups are TGI serving organizations, residents who identifies TGI, and healthcare providers. And so what this working group will do is they'll come together to collaborate and really make sure that this curriculum meets a certain quality standard and measure and being able to measure how well this training is doing as well. And so I really like that last part because I think it's really important to amplify the voices of the communities that you are aiming to help. So I really like how residents who identifies TGI have a voice in kind of creating this curriculum. This is a list of the top 10 items that an organization called Health Professionals Advancing LGBTQ Equality recommend that trans people discuss with their healthcare providers. A lot of the topics here are things that the trans community unfortunately suffer disproportionately with, including depression, for example. And the implications of this bill are to build a more inclusive healthcare. And I just like to say that education is definitely a great step, but I'm really interested in seeing if this bill passes, hopefully it does, and accountability of the implementation. How effective is the training and who is really holding it accountable. And so support moving forward, I found this great coalition called California LGBTQ Health and Human Services Network. They currently support the bill, and on their website, they have a great social media like toolkit that they have really great graphics and text. So I need to get back on my Twitter game. And then also the Health Professionals Advancing LGBTQ Equality is something I look forward to joining if I do pursue health professionals. I just went to one of their events last week and getting to hear how they have caused change through policy has been really, really cool to see. It definitely was really inspiring. And my inspiration for this bill is I am an ally to the trans community. I am queer, and so going to like the healthcare system has been interesting at times due to this. And so I feel really passionate about LGBTQ health. And I hope to continue to learn, to use what I learned in this internship to advocate for this community as well. So thank you so much. Thank you all for your time.
Thank you so much, Isabella. That was really great. And again, I apologize. We don't have time for questions at the moment, but if you do have one, please jot it down, and hopefully at the end we have some time. I'll go ahead and hand it over to Roya, who is our final intern presenting. That sounded kind of funny. She will be our last intern to present this evening. So Roya, are you able to?
Yes, I'm having a little bit of technical difficulties. This is the first time that I'm screen sharing on this laptop. So, and of course this would happen to me. Oh, okay, there it is. Yes. Whew. we did it. Okay, sorry everybody, as you all know, technical difficulties exist during these times. But thank you everybody for sharing such amazing presentation and really educating us all on all these amazing, transformative bills. So a little bit about me. So I am going to be presenting on AB 2222. I know angel numbers, Golden State Opportunities Program, a new Golden State opportunity. So a little bit about me. When I like to talk about myself, I definitely want to give a little bit of background on my own upbringing and, my identity. So I am Afghan American. I am the oldest daughter of Afghan immigrants. And I am a first generation college student pursuing a STEM degree, biology and psychology. I'm actually doing an extra semester at Sacramento State to, minor in psychology. Mental health means a lot to me, and having lived experience, seeing family members go through mental health challenges, and seeing the impact it made in my family for them not seeking help. So it does mean a lot. And so some of my passions do include, behavioral health, refugee health, health policy. I did mention that, I am Afghan, and there's many Afghan refugees that, have came to the US and, they settled in Sacramento. And so, there is a lack of resources for my Afghan brothers and sisters. And, I just want to be an advocate and, change and provide resources and really, really be an advocate in behavioral health and really work so they could, work on their traumas. And so, yeah. And some of my career aspiration is being a physician and a healthcare leader, specifically, I do want to become a psychiatrist. That is my dream goal. But, I'm open for anything. I'm open to become a primary care provider and working on preventative health, because I know how important preventative health measures are in our society. And yeah. So my experience with CaHPSA, so this had been an amazing opportunity. I did CaHPSA, and I was also an intern for Health Career Connection. So it was amazing how much CaHPSA opened my eyes to health policy. I was a little bit hesitant to join health policy because I was I know nothing about health policy, or I know a little bit, but I don't know a lot. What if I'm not a good fit? But in reality, this experience has been amazing. Learning about how a bill becomes a law. Yes, I took some government classes, but it's so complex. So being able to have Yesenia talk about how a bill becomes a law and making it very digestible for me, seeing those graphics, and I'm you know what, I actually understand this. Also learning about advocacy versus activism and how different they are. And, what kind of leader am I? Am I an activist? Am I an advocate, or am I an activist? And really some of the highlights has been being able to be in a space with like-minded people. I love meeting the interns. I love meeting Yesenia, B, all of our speakers. It has been such great and a great experience. And then also individuals who are advocating for change and for our communities. Even though we're different, we are so alike in so many different ways. And then learning about other people's story, I feel inspired and to share my story when other people share their stories. So the bill I will be talking about is AB 2222. It's a handful. But basically, this is the Golden State Opportunities Program, and the bill sponsors are Eloise, Mike, and Mark. And essentially, this bill is really to provide grants to students who are pursuing careers in behavioral health. And this is basically licensed clinical social workers, licensed professionals, clinical counselors, or licensed marriage and family therapists. And so in order to be eligible for this grant, you need to be either enrolled at a University of California or a CSU or an independent institution of higher education, and basically a private university. And basically, this will provide students with the grants up to $20,000 for 2 years. And I will talk a little bit about that as well in the next slide. And basically, another eligibility requirement is for students who commit to working in a California-based nonprofit 2 years upon completion of their program. And one of the reasons why I actually did choose this bill, because, as we noticed, mental health has been, a really hot topic. It has been it's a hot topic in public health. It's a public health issue. And there is a shortage of mental health providers and mental health professionals. And many people can't, pursue this field because of the financial burden, because of how expensive postgraduate, pursuing a postgrad. So being able to provide, financial assistance to students who are passionate about mental health and really want to come back to their community and really serve as mental health advocates. And so really addressing the shortage within mental health workforce by reducing the financial barriers for students and also administrating the $20,000 per year up to 2 years. And basically many students who are pursuing, social work, there is a requirement between 400 to 800 hours of field work. And on top of that, there is their social work classes. And on top of that, many students are, full-time workers and in order to pay for their education. And so a lot of this is a lot to juggle, and having some sort of financial stipend or having some sort of financial help really helps these individuals to focus on their field work and their education to become, the social workers or the family therapists or, the mental health advocate they want to be. And many students, cannot afford to stop working. So on top of that, the financial burden. And and so this really does impact individuals who have experienced homelessness or has experienced, the foster youth system, who really want to come back and really serve those communities and be an advocate. In addition, the current mental health workforce does not reflect the California diversity, especially with Black and Latinx professionals. They are the most underrepresented groups in the mental health field. And as we know, California is very diverse, and our mental health workforce should, represent that diversity. Yeah, and one of the sponsors of this bill is the California Coalition for Youth, and they do a lot of work working with youth. They even have a crisis line that's 24 hours, 7 days a week to really provide crisis services to students, or not to students, to youth, to family members, to anyone who's experienced a crisis. And they even have many resources that they provide to students, to youth, or to family members, anybody who is experiencing a mental health challenge. So thank you. And just thank you for this experience. And here's my resources.
Thank you so much, Roya. So we do have a couple minutes for questions, whether it's for Roya's presentation or any of the previous. I'd love to open up the floor. Feel free to put it in the chat or unmute yourself. Or if you'd just like to also say any words to our interns, that would be great.
Jessie, did you want me to say something now, or?
Yeah, I was just about to share my screen. So if there are no questions, this is, sorry, Dr. T, I didn't ask you for a different picture. It's the one off the site. But so I'll go ahead and hand it over to Dr. Trzynski. He is our CaHPSA president, and he is our closing speaker. So I know he'll have some great words to close our ceremony with.
Thank you, Yesenia. And I did this last year too, and it's just I'm so impressed and so moved, and I also learn a lot these presentations. It's just such a great event to have. It's just really, personally for me, it's very encouraging and inspiring for me to see all these really bright young people with creative ideas and energy who are going to be our future leaders. And it's pretty obvious from the way you speak and make your presentations and the thought that has gone into it. And I want to thank Yesenia also for her leadership and organizing and guiding, mentoring the students, and also B as well, and the rest of the CaHPSA staff. And I just wanted to thank the CaHPSA board members who were on tonight, Dr. Art Chen, Dr. Bill Tarrin, Dr. Palacios, Melania Palacios, Dr. Jim Kratzer, and our new medical student, Dr. to be Nimra Ahmed, who is your CaHPSA representative on the CaHPSA board. So I don't think we have enough time to summarize all the talks and what I learned from them, but I did take copious notes, and it was really great. And I did want to just one mention that made me kind of chuckle, and that's Kylie. I mentioned you work on a golf course, and I was a caddy in high school for 2 summers, so that that tickled me. That was funny, and I just had about maybe a personal experience with every speaker that I could share, but I think there isn't time. So I just want to say that your presentations are excellent, and I learned a lot, and again, I was very moved by them. So I think it's you'll take what you've learned here and all the skills, and you're going to take them forward in your careers and interacting with people and human beings in health services and in research, wherever you choose. And again, as I mentioned, you will become leaders just by the fact that you're here and have joined us. And it's so important that you've learned how to amplify your voices as young pre-health students or pre-medical students, and it's so essential. And I think CaHPSA really helps create that space for many individuals, not just yourselves, but there's so many students that we have met and mentored in our work as CaHPSA mentors. And we are here to provide guidance and mentorship to you and all our CaHPSA physicians. I think everybody is enthusiastic about that. So please, we are all open to you. So please don't hesitate to reach out. And I just want to say that you're just at the beginning of your careers. And I know people are trying to figure out what is my life going to be like? Can I engage in social justice? Can I have a good personal life? Can I be a successful professional? And I think you can. You can have, if you remember nothing else, just remember that you can have a successful and fulfilling professional life. You can be engaged in social justice work, and you could have a good personal life. And I think the CaHPSA physicians on the call tonight are examples of that. It isn't always easy, and it's a difficult balancing act, but you can do it. And so have faith in that you can do these things. And if you understand it, if those of us who are here now, it seems like we see far and we're so smart and so wise and know so much, it's because we ourselves stand on the shoulders of giants who are our mentors. And so we're paying it forward. And in turn, one day it will be your turn to pay it forward. And sometimes it seems like it came to me in a blink of an eye. So keep that in mind. And I just want to thank you for all these outstanding presentations. And I just wish you all the best. Thank you very much. And I hope at some point I get to meet you in person, and I wish you all the best in your career and your studies. Thank you.
Thank you so much, Dr. T. That was very well said, and have me a little teary-eyed because I truly believe in all that you've said, and I can't wait to see all the amazing things that our interns will do now and like the future as professionals. And so thank you all for your time. Before we close off, I just really want to take a moment to thank all of our partners and our supporters, right? Pre-health dreamers for coming in and presenting and showing us and teaching us how to be better advocates for our undocumented community and our friends and family and Young Invincibles as well, CaHPSA, specifically. Ivan, who's here, he was able to also share about his work with Health Access and our partnerships and coalition work, and Nimra, who is a rising MS1 now, and just thank you so much for your support with CAHPSA and CaHPSA. Dr. Lon Shapiro, who is also a part of CAHPSA, and Melanie, who isn't here unfortunately, but she was one of the CaHPSA leaders for a chapter while she was doing her graduate degree, and so now she's a rising MS3. And so it's great to have her return, for the second time and just share her knowledge. And then she continues to be an advocate wherever she is, and really try to support her communities in the best way in moving healthcare forward. So thank you all so much to everybody here for taking the time on this Thursday evening to just listen in, learn from our interns, and we really hope you just really enjoyed every presentation. So yeah, thank you so much, everyone, and we hope to see you next year. Have a great evening.
Thank you. Bye-bye.